Welcome to this micro lecture on dental office scheduling. This lecture complements the reading for this week, Chapter 62 on Business Operating Systems in your Modern Dental Assisting textbook. Scheduling is a critical part of any dental office, so in this lecture we're going to talk about the importance and provide a basic framework for managing appointments in a general dentist office setting. Proper scheduling will keep an office running smoothly. If it's well planned, you will maximize the use of space and provider time. This can help ensure that patients are seen on time and that providers can finish everything they had planned to do without feeling rushed, ultimately leading to better patient care. Plus, it allows an office to know who's seeing who and when. Also, to make sure that the right equipment and supplies are set up, and looking ahead, making sure that they're purchased as well, so they're available for that day. Every dental office has some form of an appointment book. While the format may differ depending on the system, the core components are the same. An appointment book's going to have the day and the day of the week. There'll be columns which indicate either room or provider, so either it's a provider schedule or it'll just indicate which operatory that patient would be seen in. And then on the left-hand side, there's always going to be time slots. Time slots are usually in 10 to 15-minute increments. And then in each appointment schedule, there will be the patient's name or account number and a brief description of the visit. Sometimes it might even just be the code for the visit. In an electronic system, if you hover over the appointment, it will reveal more detailed information, and this helps protect patient privacy as well. So I'm going to focus on just general dentist office, so not a specialist office. In a general dentist office, there's going to be two types of patients that you're scheduling or that you're seeing. One is either a new patient or an existing patient. The new patients are going to fall into three categories. Either coming for a comprehensive exam. This is a thorough evaluation, often involving radiographs, a full exam, and then a treatment plan. It could be scheduled on the dentist or the dental hygienist column. And then after this appointment, the patient is a patient of record and they can transition to existing patient status. A limited appointment, this is going to be problem focused, but not urgent. It could be something like a chipped tooth or mild jaw discomfort. The patient would have to see the dentist first. This would not be on the dental hygiene column so that they can establish care. And then an emergency appointment. Similar to a limited appointment, it is urgent, but it includes pain. It is urgent and includes pain or infection. And it's going to be problem focused, dealing with just the one issue. Immediately after the emergency visit, ideally the patient would return for a comprehensive exam. The next type of patient that would be on the schedule is an existing patient. An existing patient is going to be scheduled for one of four types of procedures. One is an operative appointment. This includes a filling, crowns, extractions. Even if it's an ortho, it would be an ortho appointment. But these appointments are planned in advance, and they are scheduled with either the dentist, the dental auxiliary, or dental hygienist, but it's not part of the dental hygiene therapy. They are called operative appointments. So for dental hygiene therapy, this is going to be on the dental hygiene column only, and it would include a recall like a regular cleaning, maintenance appointments, periodontal maintenance, and some type of non-surgical periodontal therapy such as scaling and root planing. And then existing patients, similar to new patients, can also be seen for limited and emergency appointments. The difference between this and operative is the operative was planned. A patient was seen. They knew that work needed to be done. It was planned for a specific amount of time and with a specific provider. A limited or emergency is problem focused. I'm going to return to the appointment book. And just remember that each column represents a provider or a room. Providers might work across multiple rooms depending upon an office scheduling system, but patients will be classified as either new or existing. In summary, for this micro lecture, effective scheduling in the dental office is critical. It allows for smooth operations. Whether using an electronic or paper-based system, the appointment book will always include these essential components: a time slot, date and time, patient information, and appointment type. Now, understanding these elements helps ensure the office runs efficiently and patients receive the care they need in a timely manner.